Why is a booster shot with COVID a big deal?
Well, right now, we're dealing with massive surges of cases. In the example you mentioned with measles virus, case numbers are normally quite low. So vaccination rates that give you moderate immunity initially are enough to keep the virus down. You then boost that immunity a few years later to get up to a really good protective level that lasts for most of your lifetime with measles. SARS-CoV-2 is showing the ability to change a little bit, probably not as much as we see with influenza, but it's showing some ability to change. And we also haven't gotten anywhere close to the level of immunity in the population to keep the case numbers
Yeah,
down.
yeah.
So we're still working out how we're going to approach a long-term COVID-19 vaccine policy, but I think everybody believes that we are going to be dealing with
Uh,
COVID-19 for the long term.
is your perspective, and I'm looking at the Miami Herald this morning, where the lads and the lovelies of Cypress Bay High School in Weston have their masks on. The kids have their masks on in Florida. That's got to be a good sign, right?
Absolutely. I think that, again, given the large number of cases, particularly in certain parts of the country, you want to rely on more than just vaccination status to be able to protect you from infection. So, for the short term at least, this is where masking combined with vaccination, combined with some level of social distancing, is going to be essential until we get this latest surge under control. And at that point in time, we may be able to talk about loosening some restrictions. But right now, we need to get this thing under control.
All right, given the Delta variant and given what you're talking about here, that we're going to be with COVID for a long time, or it will be with us, what's going to be the new normal after the pandemic? Will we wear masks more? Will we try to socially distance more frequently?
I think once we get a significant portion of the global population immunized against COVID-19, we're going to be seeing this virus sort of move into something similar to what we see with flu. In the winter months, we'll see surges, but those surges will be controlled because of the immunity in the population and the better treatments that are coming down the pipeline. Right now, the SARS-CoV-2 doesn't look like it changes as frequently as influenza does. So my guess is that we won't need to pay as particular attention to matching vaccines to circulating strains like we do with influenza. But again, bottom line right now becomes we've got the tools to get it under control. We need more vaccinations to get ourselves to a situation where we can return to normal.
Yeah, Dr. Pekosz, based on what we're seeing in the United Kingdom, which has seen the wave come down after a real big peak, and given what we're seeing in terms of the trajectories of hospitalizations that have reached record paces in certain places, where do you think we're going in terms of the time frame? How long will it take before we're done and we can return to sort of loosening up some of these restrictions?
So, really difficult to predict that time frame. The other variable that's really coming into play right now is that in the fall, we'll be going to conditions where virus spread should be a little bit easier, meaning that we'll be going back inside, kids will be going back to school. That will change the dynamic of how this infection spreads. So, I'm hopeful that within 3 or 4 weeks, we can get this under control and back to some sort of level of that'll allow us to return to normalcy. But the fall and coming back indoors is the big variable that is very difficult to predict right now.
And obviously what the administration has outlined is that booster shots will start to roll out in the fall beginning on September 20th. But how much does it really solve the problem if you're just giving another shot to people who already went out and got their shots, and yet you still have a wide swath of the population that isn't vaccinated?
You hit on the most important problem that I find with some of the booster policy that's being rolled out right now. Boosters are going to help us prevent severe disease, no doubt about that. So we should keep an eye on the elderly populations and others that are susceptible to very severe COVID. But boosters aren't going to help us get this pandemic under control. That gets back to the goal that we've had for the past 8 to 9 months that the vaccine has been rolled out. We've got to get more people immunized because that's what's going to control the infection, control the case numbers, limit virus spread. And we have to apply that not only here in the U.S., but globally to make sure that we're getting protection from new variants.